At this time, we will now begin with Chief Castle. Thank you.
Good afternoon, everybody. Greg Castle here for the meeting. Just going to give you a quick update and overview of where we're at as of today. Or as of February 16th, 2021, we have given 304,109 vaccines in Clark County, to include 239,241 first doses and 64,868 second doses. Those doses are being distributed in phases according to the Centers for Disease Control and Prevention and the Governor's Behavioral Health COVID playbook, vaccination playbook. Anybody who needs to schedule these appointments can go to the Health District website and schedule for any of those locations at www.snhd.info/COVID. Those appointments are made 3 days in advance, depending on vaccine availability. With that said, vaccine availability has become a problem for us, as it has across many places in the nation right now. Due to the severe weather, we did not receive our shipment of Moderna for this week, and beginning tomorrow, we are not going to be able to give any second dose vaccinations to people in need of those second dose Moderna shots. Those people are going to be rescheduled for a new appointment. We have put together a new call center that will go active in the morning and begin contacting people, letting them know that not only their appointment has to be rescheduled, but they're going to actively reschedule that group or those people for an appointment, hopefully at the same time, same day, just 1 week later. And this is not an issue because the medicine can be given within a window up to almost 40 days if needed. So it's not that the vaccine is not going to be good for you. We just try to target those other days of 21 and 28 days for the respective brands to allow a little cushion, and that's the parameters that they are ideal, but it's not going to affect anybody's immunization because it's off a week. We did get our Pfizer vaccines in our shipment, so there's been no delays in any of the appointments or problems related with Pfizer. Next week, the health district, because of this situation, is going to be administering only second dose vaccines. We are ramping up our capacity at both Convention Center and the Cashman Center and the health district site on Decatur to accommodate the people that are rescheduled from this week and the people that are coming online next week that need second dose vaccines. There is a change in one of our operating days. Cashman Center is not going to be open on Tuesday because we have some scheduled training as we begin to switch over to the state's Salesforce computer system that's going to be a big help in the long run for all of us as far as scheduling and tracking across the entire state. We have the capacity to vaccinate everybody who receives a first dose. Once we get those doses in, we're not shorted. We're just delayed in our delivery right now. We do have a significant problem with people going online and appointment shopping, booking multiple appointments at either Convention Center or Cashman or other locations, going Walmarts and whatever, and then they just don't cancel those appointments once they get their vaccine. Literally, up to 10,000 of those were identified last week, and it's very problematic. We have 3,300 appointments a day set at one of our sites, and we're averaging about 22 to 2,300 people actually showing up because those people don't show up for their appointments for whatever reason. We know a lot of that is it's double bookings. So please do not do that. If you have extra appointments, please cancel them. If you've already got your shot and you had pending appointments anywhere at a grocery store, at a pharmacy, or at one of our facilities, please cancel that and open that opportunity up for somebody else to get into line. If you're going to get an email or a appointment verification coming back, once somebody gets rescheduled, they will get an email. But if you don't get an email, please check your spam or junk folders, because sometimes that does not make it through the filters and falls into those locations on your computers. So that's pretty much my update for right now on where we're at. Any questions? Is it time for questions, Jennifer? This is my first time in your forum, so I'm not sure how that plays out.
Chief Steinbeck or Joanne, do you have anything else to add before we move on to questions?
No, I think Greg covered it. We are concerned about the supply chain issues, but we knew that was possible, and we we really wish that we had more supply here in the valley for at least to be able to absorb those type of supply chain issues. But we get the shipments when they come in, and are not allowed to have any extra standing inventory to absorb these type of situations. So that's the rule book that we currently are following, and we apologize to everybody that's going to be inconvenienced from the supply chain problem.
Yes, this is Joanne Rupiper, Director of Clinical Services. And yes, very disappointing that we did not get our Moderna shipment this week. Typically comes on either Monday or Tuesday, and we are not expecting it until later this week. I do want to say a great thank you to all of our community partners who have really helped us out so far in being able to provide vaccine. Yesterday and today, they were able to lend us some vaccine so that we could keep operations going. But right now, as for tomorrow, Thursday, and Saturday, we just don't have the vaccine available right now to vaccinate those individuals. So anyone with a Moderna appointment will need to be rescheduled.
At this time, we will move on to questions from members of the media. As mentioned earlier, if you have a question, just use the raise hand feature. Our first question today comes from Mr. John Treanor. I am unmuting you now, sir.
Thanks all. We got calls from people who had gone to get their second dose at a different location than they got their initial dose, and they were turned away. My question is, if somebody gets their first dose through SNHD, can they then go to get their second dose somewhere else from a private place, whether that be a grocery store or a clinic?
Right, that is, the issue with that is whoever gives the first dose can order the second dose. So if we give 5,000 first doses, we can order 5,000 second doses. If we give that dose to someone who didn't get a dose from us, then that could be an issue. We're basically giving that vaccine away to someone else. So yes, they do need to go back to their original providers. There's been a few instances where either, for example, a person lost their job at their employer or some other extenuating circumstances, we can help them out. But as a general rule, they need to go back to the original person.
Thank you. The next question is from Brianna Erickson. Unmuting you now. There you go.
Hello, thank you. My question is, how do you determine whether someone in a particular occupational category is actually a frontline worker? And yeah, how do you determine that at the sites?
I think I heard your question. I had a hard time hearing, but how do you determine if they're the occupational worker in the correct categories or groups at the sites? Is that what you mean?
Yeah, she was just, how do we verify that?
Sure. So we use the Nevada's playbook as our guide, and we look at all the different categories and definitions underneath. There is some room for interpretation, but usually we determine who would be eligible for the clinics and who would not. And so then at the clinic, our frontline workers check to see if they're in that occupational group or not.
Next question today comes from Mary Hines. Please go ahead.
Hi, thank you. Can you hear me okay?
Mm-hmm.
Yes.
Yes, okay, great, thank you. What is your best estimate as to when those 65 to 69 will be eligible to be vaccinated in Clark County? And also, what is the process for determining when a new occupational group or public group will be eligible?
Well, for those two topics, are going to be pretty much the same answer. We're going to be led by the governor's task force on COVID. When they determine that we've got to a certain point that's comfortable to make any kind of moves like that, they will put that out. And as districts and providers, we will adjust accordingly and then information out to the public, our change in operation, and so forth.
And next up is Jaclyn Schultz from Fox 5.
Hi guys, wanted to, if someone, or Joanne, if you could also clarify a little bit further on, it's Thursday and Saturday that the second dose appointments are going to be canceled, and then rescheduled for the same time frame. But my big question is, I had heard that the people who, or the 7th case of the UK variant was someone from out of town, an international traveler from French Polynesia who possibly caught it here and then had trouble getting back abroad because of, being found with the UK variant. If you could expound on the 7th case of the person with the UK variant.
I do not have knowledge of that case. I'm pretty much in vaccine operations, so that would have to be. I believe you could follow up with Jennifer on that question, and then we can get, some guidance from our epidemiology department.
Before we move on, since we couldn't hear Brianna's question earlier very clearly, she was actually wondering, how do we determine whether someone in a particular occupational category is actually a frontline worker rather than, say a back office worker type of thing?
Well, we send communication to those industries or groups, and we have them communicate to their frontline workers who would be eligible. We do not ask questions at the front line, specifically what their role is. I mean, we ask that people be forthright with their information and go forward from that. Does that answer your question?
Hope so. Okay, let's go on to Ms. Astrid Mendez. I'm unmuting you now.
Hi, how's it going? I think part of the question is, where exactly are we standing right now? There's a lot of confusion with not only, the frontline workers, but also which people from other industries are able or not to get an appointment now. So I definitely would like some clarification in that. Where exactly and who exactly right now is able to get an appointment, either in one of the two lines that have been described at the Nevada playbook. And also, I would like to know more a little bit about what happens, with those vaccines in case that somebody that was scheduled for them either at one of the SNHD locations or at a pharmacy, and if people don't show up, what happens in those cases? Like, do they go to waste? Do they reach out to other people? How is that working to ensure that the vaccines are not going away? So there are basically two things in here.
Okay, so I'll answer the question about the second doses, and if people don't return, we just keep it until the state or CDC gives us guidance on what to do with that vaccine. So there may be extra vaccine in our refrigerators right now or freezers that we keep until we are given more guidance on that. So it's in a waiting period. We don't have to waste it because it's in the freezer and can be kept for about 6 months. So we only draw up vaccine at each clinic according to who comes through the door. For the lanes that we have, we're at 70 and up in the what do they call that lane here? General population. For frontline essential workforce, we are right still at frontline community support under continuity of governance, and that's where we are right now. This community support frontline staff is kind of confusing. So frontline workers who support food, shelter, court, legal, and social services. and other necessities of life for needy groups and individuals. So that is the basis for most of who we have guidance on who can get the vaccine. For example, shelters, people who work at WIC, social services, some utility workers that may be involved in keeping the lights on and the water going for individuals, and shelters. Those are the types of frontline workers we're talking about, as well as education, and of course those frontline educators, staff, and students for NCHE. Does that clarify? If there's a specific question about a particular group, we can explore that.
I was just going to add something briefly, that at the sites, I know you asked how they're verified. Certainly for the first shot verification specifically, you will be asked if you're going down that lane, the occupational lane, or then you'll be asked for a work ID or a pay stub or some sort of verification as to your employment. And that's what they actively do.
We're going to proceed through all the people who have got their first time questions. We'll circle back if time allows for any follow-ups. Our next person now is David Charns. I'm unmuting you now.
Thank you. Good afternoon, everybody. My question is for Director Rupiper. In the data that's presented on the website in terms of where people are getting the vaccine, correct me if I'm wrong, but the reported vaccine frequency by zip code is where people live that are getting the vaccine, not the vaccine, not where the vaccines are being given out, correct? So these are...
Correct, yes.
Okay, so when you look at that map, this is something that was talked about at another call, and something that the governor has talked about. I mean, the areas that the areas of the valley where people are living below the poverty line seems to be rather low in frequency. So what is the health district doing, if anything, to make sure that the vaccine is being distributed equitably? Because, you know, you look at this map, and the southwest, southeast, and northwest are doing pretty well, where northeast, which are communities of working class folk, are seemingly not getting the vaccine. So can you speak a little to that?
Sure. So if you look at who we've been immunizing first, it was the healthcare workers and first responders and police force. So it may be that reason why those zip codes are more highly vaccinated than others. Frontline community support, we're talking education. The frontline workers who support social services, county type of workers, that may account for some of that. And then on the age group, it's 70 and up. So when you look at a map of age groups for the county, those age groups are also in that area, in those areas. So that may account for why there is a discrepancy so far. I will tell you, we've had clinics in the other zip codes targeting those populations. And for example, we did in our own, if you notice, 89107 is our zip code for the health district. So we did assist a neighbor of elderly residents to come and get their vaccine. And we've also had clinics in those zip codes as well. And we've had pretty good response. So we'll continue to do that work. And we're also we're also in partnership with Immunize Nevada, and we have a REACH grant that will also reach out to those communities, the Hispanic and the African American communities, to encourage them to come and get vaccine. There may be other reasons why they would not want to get vaccine. As I've talked before, some people are more hesitant than others, and there may be different reasons, maybe a personal experience, maybe a group experience that makes them hesitate to get vaccine. So those are the types of things that we've been doing.
I'd like to add on to that too, Joanne, if I may. The sites we've had over the last several weeks are dead set in the middle of those areas that you're trying to speak of. El Dorado High School, Desert Pines, Hollywood Recreational Center, Mack Middle School, Parkdale Recreation Center, Cora Coleman, etc. Plus Cashman and Convention Center are both located in locations that are, meet the demographic groups that you're speaking of. We have also worked with many elected officials from various boards and commissions and councils that have gone out and canvassed the neighborhoods trying to get people to sign up for this, and that's had some mixed results. We've had as little as been able to fill 50% of vacant spots open for certain sites. But at one point in time or another, we have to open those sites up to the rest of the community. So if we have, say, 300 appointments closed for trying to target seniors and people in those particular areas, but only 140 of them sign up, we owe it to the rest of the community to open up those 160 spots to whoever meets those tiers, and they will drive. We've had people from some of our sites here in town, have people from out of town show up because they're allowed to do so. So we have done our very best to target that, and we are still working on that. We will continue to work on that. But once things progress and we get into some different tiers, I anticipate those numbers will switch.
Thank you, Chief. We're going to take one more question now from Michelle Price. Unmuting you now.
Hi, this is Michelle Price with AP. I have two questions. I'm just wondering on the Moderna second dose appointments that have to be postponed, how many people are we talking about roughly? And then generally for the problem we're having with people making multiple appointments and not canceling them, how do we know that that's what's going on? Have we been able to contact them, or do we have some way to check to find out that they got a vaccine somewhere else?
Right. Well, we can pull reports on all of our appointments for the day, and we do have a number that were canceled. We really don't know if we don't have the capability to know if they showed up or not. That would take a more sophisticated IT than we have right now. So we have difficulty doing that. So yeah, I mean, I think our platform was not the best in the beginning for canceling appointments, and that's part of the issue. And the issue for the second dose is we have not been able to schedule it right away, immediately when they make the first dose appointment. So we have to wait until they complete their first dose before we can schedule their second dose. So there have been challenges with that as well.
Thank you, Joanne. Our last question today will come from Michael Scott Davidson. Any follow-ups or clarifications, please send those to the Office of Communications. At this time, we're taking Mr. Davidson's call.
Hi there, thank you. Given what happened with the temporary break in the supply chain with the Moderna doses, I think to how the state of Nevada's strategy for ordering second doses is to just order what they need for the week ahead, the coming week. Given that we've now seen an incident here where we see a break in the supply chain that, because we don't have those doses in the state, has caused us to push back appointments, I'm wondering if the Southern Nevada Health District or anybody in our team right now is, considering whether asking the state to perhaps change its strategy to get more second doses inside the state than we absolutely need for the next week ahead, so that if there is a break in the supply chain for whatever reason, we won't encounter a problem again like we're encountering right now.
Yes, we've had multiple discussions with the state on this, and keep in mind that the federal, it's actually federal that makes the rules for most of the vaccine distribution. So the state, and we have had conversations about having more of a supply on hand, and that maybe, I hope we can do this in the future. That is yet to be determined on how much we can keep on the shelves. So we're really hoping that that can be, that will be definitely the case. We had to schedule about 5,000 doses for these next 3 days, Thursday, Friday, Saturday, and we'll be rescheduling those next week. We're focusing on all second doses next week, and so we really hope to get most of the people that need or that are coming back for their second dose can get that second dose. We also have a clinic this week at Desert Pines that is also doing Pfizer second doses. So what my ops team wanted to make sure that you were aware of that, and people can walk into that one, and that information's on our website.
Yes, Michael, I'll add to that just a little bit as well. It's exactly what Joanne said. We're very grateful to the state and to the feds for every dose that we get. Operationally speaking, it's very difficult to plan when you're not positive on what's coming in and you're in a week-to-week and even narrower type of scheduling. But the priority was to get the doses out into the community as quickly as possible, and then deal with fallout if they don't come. And so we understand that, but on our side, it'd be much easier and more efficient if we were working off of a supply that was currently in the valley, and we could plan a week in advance instead of days in advance.